conversation about the use of cellular device location data, particularly within the context of COVID-19. So these data have been, these location data based on cell phone locations have been popularized in the last several months, and primarily they've been popularized by media outlets who have been doing sort of their own analysis or reporting on when people are leaving their homes, how often they're leaving their homes, where they're going if they're leaving their homes, or where they're not going. And all of these data have been from our cell phones, from our smartphones. And in addition to newspapers and media outlets using these data, they've also been used by in more empirical research studies as well. And this has been a really interesting partnership sort of between private data companies who have basically given their data to the research community most of the time for free or at a low cost in the context of the COVID-19 pandemic. And so before I get into what the research is showing, I first just want to start with what are these data and how are they capturing, what are they capturing and how are they doing it? So I've got several slides here showing you different sources of the cellular location device data. And the first one that I'm going to talk about is from a company called SafeGraph. And I will readily admit that I know SafeGraph data the best because I have personally used these data in several different research studies in the last several months. So the SafeGraph data, the company provides two different data sources, two different products. So one is called SafeGraph Patterns, and this database is the point of interest, and it shows the foot traffic for each point of interest. So, for example, if somebody wanted to know how many people were going to the gas station on 5th Street or Spring Street or the McDonald's on a different street, this database would provide the number of devices that were visiting that particular location. The second database is the social distancing metrics, and these data have been provided to the research community during the COVID pandemic so that researchers can study various social distancing questions. And so these data offer the distance traveled by devices from their home location, and also the duration of time that devices spend, for example, in their own homes. And so these are reported to researchers at the census block group level, so at the neighborhood level, and also and some of these metrics can be broken up by different time dimensions as well. So, for example, was the device inside the home from 3 p.m. to 6 p.m. or something like that. So this link right here is where you can go to submit an application for these data. You do have to submit an application. However, they are free, at least from January 2018 through 3 days ago. So there's a 3-day lag. So you could get data from 4 days ago. And you just have to be using these data for COVID-19 related work. And I'm not even sure actually that requirement is still in place, but it was at the time that I requested the data several months ago. The different time dimensions vary based on the product. And so in the patterns database, there's weekly, the data are reported weekly and they have breakdowns per day and per hour. And the social distancing package has daily information and it's broken down per hour. The geographic unit of interest in the SafeGraph data for the patterns database is the point of interest, so the location, whereas the social distancing metrics data, the geographic unit of interest here is the census block group. So it's actually quite fine data if you're studying, for example, neighborhood movements and neighborhood mobility. SafeGraph produces its data from a variety of third-party apps. So these are apps that are using their location trackers, that have their location trackers on, and compiling using all of those different apps. For now, SafeGraph is limited to the US, and they are still, as I understand, receiving requests and interested in requests, particularly regarding COVID-19 related research. The second data source that I'm going to be talking about is the Place IQ. And so these data are really more of indices. So the first product is a metric of the share of devices that are traveling out of a particular geographic area. So for example, in a county, 2% of all devices went from county A to county B. 3% of all devices went from county A to county Z, all within a 2-week period. In addition, they have a device exposure indice, and this index basically shows how many devices a particular device was sort of in contact with. So they basically visited the same commercial venues as sort of the home device. So if we think about these devices as people, it'd be the equivalent of how many people did this person come in contact with. And so they create indices for the number of devices that each device is coming into contact with. Here's the link for this particular data set, and it is available from January 20th onward at the daily level, and the geographic unit here is the county, which is based on neighborhood census block group level data. So these folks get their data also from a series of applications that of apps that record locations, and they have tried to make their data representative of smartphone users, and they also have a limitation on just non-commercial uses. So for research purposes or for class purposes, for example, those would all be applicable and valid reasons for requesting the data. Again, these also are limited to the United States. There's a third app-based, multi-app-based product here, which is Uber Media. Uber Media, I should note, is not free. So this one does have a cost associated with it, and they have all sorts of different packages. So the different type of data that you might be interested in, they have different price points. So they have 34 metrics within their COVID recovery insights data, and there's the link for this data source. They have data dating back to 2014, though it took a while to sort of increase the number of devices that they're basing their information off of. And they really started this mostly as an ad campaign, like an advertisement, and not at all COVID related, right? This was 2014 when they started collecting these data. And they were really trying to understand whether different advertisements or different campaigns were effective at getting people to visit stores, for example. And so their geographic unit is the store or the point of interest, or sort of a market, which is based off of basically neighborhoods. They use over 100,000 apps across several different phone networks to build their database. They are international except for a handful of countries, and they are also interested in COVID-related work, but again, that you do have to pay for these data. Apple Maps has also produced some interesting data in their mobility trends report, and so there's the link for these data, and they have data from January 13th, 2020 up until the present time, and these data are at the city day level, and so the source of information here is coming from Apple Maps, and basically how often people are using that particular app and where they're going. And they have data internationally, and similarly, Google Maps has produced a COVID-19 mobility report, which can be found at this link right here. And they have data from January 3rd, 2020 onward. And these data are also daily. These are measured daily at a region level. So for example, at a state level. And they're getting their data from Google Maps, the Google Maps app. And the interesting part about these data is that they actually are taking, as opposed to, for example, SafeGraph, which you can actually get the metric of, for example, the percent of devices in a particular neighborhood that are staying at home the entire day. That's an example of the type of metric you could get from SafeGraph. From Google Maps, instead, you're going to get something like the relative movement compared to the 5-week period of January 3rd to February 6th. And so every metric is compared to that particular time point. And these data are also international. So those are just a handful of the data sources that have been popularized in both the media and also been used in some empirical research. There are probably others out there. This is just sort of a handful and some of the more commonly used measures, at least that I've seen. So now I want to talk a little bit about how these data have been used in empirical research. So the first way that, and this was especially very early on in the pandemic, these data were used primarily as an outcome of interest. And so, for example, this particular paper is trying to understand the role of government interventions at both the state and local level in response to the pandemic, and whether or not these policy responses were effective at getting people to stay home. So, for example, from this paper, this is a graph that's taken from this paper. This graph is using data from SafeGraph, and so it's showing the average hours that a device or that devices in a particular neighborhood are spending at their homes. And so what you see is there's a general increase from the beginning of March to the middle of April. And these darker lines here are showing when states began to implement their stay-at-home orders, if they did. And what you can see here and what they find in this paper is that people started staying home, according to the SafeGraph data, before stay-at-home orders went into effect. Instead of the stay-at-home orders being effective, it turns out that first case announcements and emergency declarations and school closures were far more impactful at increasing time that people or devices spent at home. And so this here, this figure on the right is showing you that emergency declarations, before they were announced or before they were implemented, had no effects beforehand, but then after they went into effect, started to increase the amount of time that people spent at home by about 45%. So this is in contrast to the stay-at-home orders, which did not necessarily induce social distancing quite as well. So this work here is work from our very own, some folks over in GTRI, and they're on the call here, and so they'll be adding to the discussion here in a little bit. But they do a similar exercise here, but they break it down also by rural and urban communities to, for several reasons, we might predict that rural and urban communities had different responses to the pandemic, particularly early on. And so each of these box plots shows the stay-at-home orders and the post-stay-at-home orders for each of 9 different types of areas, different counties. And so, for example, the ones over here are the most urban, and the ones over here on the right are the most rural. And so what they find is that all types of counties, regardless of their metropolitan status, increase their time that they spent at home, according to SafeGraph data. However, it does look like possibly the urban areas increased their time at home after the stay-at-home orders, possibly more than the rural areas. But the reality is here that they all increased regardless. And of course, there have been multiple extensions from these two examples, which were sort of what I consider the first order effects of these policies. And so this paper that I'm highlighting here shows you that people were more likely to stay at home, or I guess their devices were more likely to stay at home if they had greater access to internet. And they also had one of these stay-at-home orders. And so, for example, the columns on the left here, the bars on the left are showing you that there's really no difference between internet access, between staying at home and across internet access in states that did not have these stay-at-home orders. However, in states that did enact stay-at-home orders, internet access was a driving factor for the ability to stay at home. And then sort of on the back end of the pandemic, I say that knowing that, we're nowhere near the back end, but I guess the back end of the reopening of the policy response at the local level, we see in this paper the impacts of reopening policies at the state level on different mobility patterns. And so this figure on the left here is showing you, this is using Google mobility data. And so people here started to return to retail and recreational locations before states reopened. And so the states reopened here, that's the red piece in each of these lines. And you can see that people are starting to visit these venues long before their states actually reopened. So that, and this figure on the right here is showing you that states reopening policies did increase traffic to retail and recreational locations by about 8%, but you can see that this trend is starting to pick up even before those policies were in effect, which is the point of the figure on the left. So that's sort of what I think of as the first stage, where we use these mobility data, these cell phone location data, as an outcome variable. And the next thing that lots of research has done is using these data as sort of a predictor variable. So to see how time spent at home or how different sources of mobility has affected other outcomes. And this is really where most of my research fits in. So for example, I'll show you here a few figures from several different papers on COVID-19 and domestic violence and child abuse and neglect. So as of now, I have 3 papers that have been submitted for peer review on the various effects of COVID-19 and the policies that are associated with the policy response and family violence, household violence. So this first set of figures I want to show you are demonstrating the effects of time at home on domestic violence. And so this right here, this figure is showing you from SafeGraph data, which is that first data set that we discussed. This is showing that more people started staying home after the stay-at-home law went into effect in the city of Chicago. And you can see that this is both the percent of the day that a device was staying at home, and then this is the percent of the day that a device stayed completely at home, so it never left the house. What we do in this particular paper is then we see, okay, what happened to 911 calls that were reporting domestic violence. And so what we see in this figure is that in the weeks leading up to the stay-at-home order, there's no significant difference between 2020 calls and previous year's calls. But then after the stay-at-home order, we see an increase in domestic violence calls to 911 by about 7.5%. And the use of the SafeGraph data, the use of the cell phone location data, is that we see that the calls to 911 reporting domestic violence increased the most in the neighborhoods that stayed home more, that were able to stay home more, and that did. And so this is just showing you the different quartiles of time spent at home, and that the increases are really concentrated here in sort of the quartile 2 and 3 and 4. So the next set of figures that I want to share with you is looking at the effects of time at home on child abuse and neglect. So just a quick sort of background slide. This is looking at child abuse and neglect referrals to Georgia Division of Family and Children Services. This is our Child Protective Services agency in the state of Georgia. And this red line here is showing you, this red solid line is showing you 2020 report levels relative to 2019 and 2018. And we see that referrals plummeted by about 55%. And this was largely driven by education personnel and child care personnel, which is what that orange line is showing you. And so this is the adjusted estimates here, the referrals dropping by 55%. Now, the cool use of cell phone tracking data in this particular paper is that what we then do is look at the relationship between time spent at home and child abuse and neglect referrals. And what we see in this paper is that the role of time at home and child abuse and neglect referrals is really meaningless before the pandemic, right? These estimates are no different from zero. But then after the pandemic, after Georgia issued its emergency declaration and schools closed, we see that there's a much more precise relationship between time spent at home and referrals. And in particular, it starts to increase. So there's a relationship here, a positive relationship between time spent at home and child abuse and neglect referrals. And so what this is showing is that for each additional 15 minutes that a set of devices in a county stays at home, there's about a 1% increase in the number of child abuse and neglect referrals that county will receive. But again, that relationship is totally non-existent outside of the context of the COVID-19 pandemic. So the overall conclusions, at least just from this short discussion, is that social distancing is certainly necessary to curtail the spread of COVID-19. Our public health experts are telling us this. And the data that we are carrying around in our pockets and our phones can be really informative, not only from a business perspective, which is sort of what these data have historically been used for, but more so now in the context of COVID-19 and determining sort of these larger macro level societal factors as well. And so just for one example, we've seen that more time spent at home based on cell phone tracking data is associated with more household violence, which again, we know thanks to the data that's in our cell phones. So I am happy to take any questions about any of this work that I've presented here. I know we've got Charity and Jason who were part of the team that did one of these studies as well. And then also just open it up for larger conversation and dialogue about the use of these data, particularly in the context of COVID-19. And feel free to use the chat function too, that's available.
Hey, Lindsay, thanks. That was awesome. A great quick summary with a lot of information. I'm curious, this is Matt Sanders. So I'm curious, obviously the things you covered at the end were negative, impacts. And I'm curious if there's anything where anyone's documented any positive impacts, um, and what kind of the intersections of those things might look like. So and not to kind of dismiss, the consequences and the negative consequences, but I'm assuming that there's also been some things where we've documented kind of positive things of families being together, or people being at home, and not interacting with other things that might be negative for them.
Yeah, absolutely. So there have been several benefits of staying at home. Now, most of these studies, to my knowledge, are not necessarily relying on cell phone data, but there have been, for example, fewer traffic accidents. So that's great. There have also been documented, if everyone who was injured or sick went to hospitals and other sorts of medical providers or clinic locations, our medical system would be enormously strained. And so there's been some evidence that people not going to the hospital, at least in the short term, for the medical system has been a positive thing. Now, of course, that leaves an open question about whether untreated care or untreated illnesses will lead to sort of long-run consequences. There's also been some evidence in the medical literature suggesting that childhood injuries, for example, have reduced because kids are not on playgrounds or they're not playing sports. Now, there again are sort of these trade-offs, right? Is that really what we want if we know that these things are potentially good for children? So yeah, there have certainly been these documented benefits. One thing that I think is really important to recognize is that, this has been 6 months. It seems like it's been forever that this pandemic has been around, but the reality is in the research world, 6 months is like a snap of the fingers, and it's really hard to actually accomplish empirical research in that time. And thanks to, in part, several agencies and private companies that are basically, releasing these data so that people can do this kind of research on a quick turnaround, this is unprecedented. This is not common in the research space. So the fact that we even have evidence of all of the things that we do, I think is quite impressive, given that in sort of normal times, all of this would have taken much, much longer and many more resources. So unfortunately, I don't have probably a more comprehensive answer than that, but there certainly have been some documented improvements.
Yeah, and this is Charity. I can add to that too. So I definitely have seen things around pollution as well. So that kind of goes along with traffic. It's kind of along the same lines. But yeah, I'll add to the, so some background on our group. So we work with the CDC, and that's who we published the paper with, and their public health law group. Yeah, and it has been amazing, and we worked closely with SafeGraph to have access to this data, and it's certainly, one of the reasons that, CDC came to Georgia Tech, because they have never worked with this kind of data before, and it's all novel to them, but it's been really helpful for them to understand the response. And certainly, as they have outbreaks in specific areas, it's certainly been really helpful to understand how mobility is changing and how it's related to those outbreaks. So it's been this data has been really helpful for a lot of our research internal to the CDC and obviously the published work as well.
We had a question come in the chat. Oh, you're answering it. Never mind.
Yeah, so there's a question in the chat about the representativeness of the data. And it's certainly true that, these data are representative of smartphones and of smartphones that have their locations turned on, which is certainly not representative of the entire population, for example. And so it's also challenging to test how representative the data are relative to the whole population, because the cell phone data do not, and the data providers don't have any information about the actual phone users, right? They've been very intentional not to collect data on, or if they've been collecting it, they have certainly not been sharing it with researchers about, for example, the gender or race and ethnicity of the smartphone user themselves. So there's been a little bit of work to show that, these data, particularly, I know, for example, the SafeGraph data seem to be pretty representative of, yeah, there we go, Charity just put in the link. Yeah, they've done some, SafeGraph, I know, has done some work to, and they've produced this in sort of a methodology report where they've tried to show the representativeness of the data.
And is that relying on the census track, the data that we have about the census track?
Yeah, to be honest, I'm not sure exactly how they're comparing the data. The link that Charity included here might be more helpful. And they also have a whole web page of documentation at SafeGraph. They do. PlaceIQ also has documentation that allows you to see sort of exactly what their data are collecting, how they're doing it, and how representative it is. So I will say that PlaceIQ has been trying really hard to make sure that their data are representative. And I think SafeGraph has too. I know a lot less about Uber Media, for example, or Google Maps or Apple Maps. I think those are just based on, who's using the apps.
Yeah, Google and Apple are pretty much a black box at this point. So SafeGraph does try to be really open and transparent as much as they can. Obviously, one of their main goals is to protect privacy. So, everything will be aggregated, and, any sample size that's too small, they'll just drop off. Yeah, this link that I shared, they've done a good job of trying to compare the census, and it is at the census block level, which is the lowest level that SafeGraph provides. And it basically compares their data to census counts, census attributes, block attributes.
This is Jason. There are a number of limitations that you should note, of course. I mean, it's based on population. People can have more than one device. People move around. People's home location is indicated by where they've spent the last 6 weeks at night. So, for instance, we've run into challenges as we're looking at things like mobility for institutes of higher education. One of the questions was, how did college students move during the Labor Day weekend? But by Labor Day, most of them had not established the campus as their nighttime location. So it is very difficult to do that with that 6-week window.
Yeah, that's right. And on that note, we were looking at data for the state of Indiana at some point in April or May, and we saw several counties where they actually decreased the amount of time that they spent at home, which was at first very perplexing. And then when we dug a little bit more, it turns out that every single one of these counties was like a college town county. And so it would be all of the college students who were leaving. So of course, they're not spending time at home anymore, but it's because their home location was based on their location for that's right, their home has been redefined.
Fascinating. So this was awesome. I'll echo Matt's comment. That was just a lot to consume. You did a fantastic job, and thank you. I've been sitting here thinking about this issue of how representative it is, and how that has obviously changed over time. So you could imagine. I mean, 10 years ago, there was probably a high correlation between people that own smartphones and their mobility. They're likely to be in likelihood of being mobile, right? The early adopters were the people that were on the move. But now I would hypothesize that gap has been reduced over the last decade as the smartphone penetration has increased. But I still have to think there's a natural correlation, at least, between people that own smartphones and use them and have the GPS turned on, and people who are naturally inclined to move around, right? And so I think about the folks that are of my family that are elderly and what have you, that they're less likely to be using these devices. And so,
Russ, one thing to consider there is that the types of people that install the third-party apps that have the trackers are also maybe not always the most tech-savvy folks.
Interesting. Yeah, very nice. Yeah.
Yeah, that's right. And a lot of the data that have been using these as a lot of the studies that have been using these data have relied on, not all of them certainly, but a lot of them have relied on analytical methods that would allow for comparison and trends. And so some of these questions, at least in terms of the bias presented in some research studies, is a little bit less of a concern because, the biases exist before and after, for example, a stay-at-home order. And so the question really is, are the people who are likely to turn their location data on or off, are they likely to do that sort of in response to a stay-at-home order, just as an example? And there's no real reason to think that would be the case. And so if that's the assumption, then, maybe these data are biased in a particular direction, but as long as they're biased in basically the same way, both before and after the stay-at-home orders, then it's less of a concern.
Thank you. That's very nice.
One other thing that we had to consider, especially in our early MMWR, is also these things are configured such that you typically you're more likely to send a GPS signal when you're moving. That's how these things are because it saves power. So there's actually been a drop-off in the number of devices in the panel, especially at the beginning. And so it's very hard to compare day over day. You're looking at proportions of devices, not raw counts, because sometimes they're not in the panel that day.
That's right. And sort of building off of one thing that Charity said earlier about SafeGraph in particular, which drops block groups or neighborhoods that have fewer than, I think the number is 5. If there are fewer than 5 devices that are pinging, then they will drop that particular observation, that block group. When I did an analysis both in Indiana and the state of Georgia, we dropped all of the block groups that did not have that were not what we think of as balanced. So they weren't in the panel the entire time. So they could have been dropping out for that particular reason. And that ended up being less than 0.5% of all block groups. So it ended up not being a huge problem, at least in our case.
I'm wondering if Florida would be interesting to look at, given the reopening combined with the tourism industry and the retirees and the normal kind of migration there. But it seems like there might be something interesting there, mobility-wise, and whether I think there's some questions about what reopening means, and I think to the point that you made with one of the earlier graphs that the behavior changed before the stay-at-home orders, and I'm curious whether Florida is going to look any different given kind of the education level that people have around it versus what the response has been.
Yeah, and I don't know off the top of my head, but I do know that some of those earlier studies that I was discussing, I mean, they include Florida, right? They include all states across the country, so they have data in there on Florida specifically, but I don't know off the top of my head what exactly their response looked like. But we could get it. We could download the SafeGraph data right now and find out.
Yeah, yeah.
You can always go to the CDC COVID tracker and look at the dashboard.
Yeah, right.
That too.
Or you can just ask me for it because I'm the one that publishes it.
So
right, little plug there for the tracker.
So I am curious about other data sources. Has there been any? So to kind of get at some of the issues you were just talking about, I wonder if any of the wired providers are doing similar things. AT&T and Google and Verizon and their wired networks in terms of, activity levels by census block or, households and things like that. Have you seen anything in that space?
I don't know of anything that specific, but I do know of a different source that's led by Raj Chetty, an economist out of Harvard. It's called Opportunity Insights, and they have collaborated with several different private companies that have provided their data to show things like, credit card transactions to see what types of places people are spending their money, or where they're going. That's just one example. They also have like education platforms online and use of these types of platforms. And particularly one graph that I have in my mind is they have this education platform, use of the platform over time during the pandemic across household socioeconomic status, and shows that children from higher income families are more likely to continue using this service as opposed to children from lower income families. So they've compiled a variety of data sources from private companies that have basically provided them their data. But in terms of wired networks, I don't know anything off the top of my head for that. If anybody else does, please feel free to chime in.
Yeah, I don't either. Most of the data sources that we found are these kind of like, secondary app type data from mobile devices. We did talk to one vendor early on that had a direct access to Verizon network, so it would be limited to like Verizon's network, but it would have been everybody in that network, so it wouldn't have been, limited by people who have apps installed, but it would have had other biases, obviously. But we ended up not going with them because, the cost and lots of other reasons. But anyway, there are companies that do that kind of thing, but generally, no, I haven't heard. SafeGraph also has a partnership with some credit card companies too. So if you sign up to be part of the data consortium with SafeGraph, you do get access to some of that credit card data as well.
For what it's worth, I think there's a lot of unanswered questions about how time spent at home, which we can easily get. We have the data from SafeGraph and from PlaceIQ, and how this mobility piece or immobility has affected a variety of different outcomes. So for example, I just showed you the household violence, but there are all sorts of other questions that are out there that are completely unanswered, but can be at least dug into a little bit. So I think that the opportunity for researchers right now, particularly in trying to get information out about what is happening with individuals and people and companies during the pandemic, I think it's a ripe opportunity for researchers who are interested in this particular space or in this data source.
Does anyone else have additional questions for Lindsay or Jason or Charity or anyone else who's interested in these things on the call? There's a lot of comments saying how informative and interesting the data and information was that you presented. So kudos.
Thank you.
No, this is Beth. I just came in after everything was already underway, but just thanking all of you for coming. This has been fantastic. So thank you very much for sharing and for discussing this with the larger community.
And thank you all for joining.
Yeah, I'm just thinking about, all the ways this goes. As you said, we're only 6 months into this. 2 years from now, 5 years from now, the studies that are going to be possible because of this data, right? As we look at, obesity and alcoholism and all the other things that at least anecdotally we're hearing are part of this crisis in the making, right? Not to mention educational outcomes and those sorts of longer term impacts, and this kind of data is just going to be phenomenal to be able and understanding how to use it and the right way to use it and what it really means, but then looking at these other studies in that context, it's going to be such a game changer. And so, yeah, again, thank you for helping us to start to think about it, right, and put it in that context.
Faith, I have the slides in case if anybody wants the slides, I'm happy to share them. So Faith, I can send them to you, and if that's okay, and then we feel free to contact me. I'm happy to send them too. Sorry, I think I interrupted somebody. Was there something else?
Oh, I was actually Beth might know something about this. I don't know. I'm thinking about Munmun Deshadri's work and whether there's an opportunity to, because I don't remember if that has location, and if it does, what it has in it. But that's social networking data, right, where it looks at some issues around, I don't know if domestic violence is in that list or not, but I know
PTSD and mental health
PTSD.
And other, strongly related. I only think campus life has a locational aspect to it, but I don't think other Munmun studies yet have pulled that together. So I think this would be an interesting opportunity to look at that. No, and I think the other, so Lindsay, we'll circle back with you. We think we're about to get awarded a RADx grant for COVID testing with underserved populations. And so what we really have to do is to both figure out the populations at risk and then ways to reach them. So other ways of making sense of this data.
Yeah, that's been a tricky. I'm thinking particularly about children, and so one important distinction here is that victims of domestic violence are oftentimes self-reporting, right? So they are the ones saying, "I am a victim. I've been abused here or assaulted," whereas children are never self-reported, right? There needs to be a third-party observer, and so in the context of COVID, this has been an enormous challenge, as I showed you. Referrals for child abuse and neglect just plummeted because there were fewer eyes on children, and so trying to reach children, I know, has been a challenge, not only from child abuse and neglect, but also from education. What do you do if a child is not logging into virtual school for 2 weeks straight? What do you do? How do you contact them? And the reality is a lot of these children could very well be just left at home because their parents are essential workers or frontline workers, and school was where they had to go. And if school's not in session, nobody's sitting with them right there to get them onto their computer, or even maybe they're left with an older sibling who is responsible for them, or something like that. So how do you reach these children? And also understanding that the household strains have increased enormously as a result of this pandemic, as it has for everyone, right? Nobody's better off right now than they were 6 months ago. But we're all sort of in the same storm, but we're all in very different boats, right? And so how do we get the kids that, at least that's where my mind has been. How do we protect the kids that need it the most?
Yeah, and I don't know have you connected to Lizanne DeStefano with these questions, Lindsay?
I have not, but you're right. I should, because in the last paper that I presented here, the one on child abuse and neglect, we see this really interesting finding, which is that more time at home is associated with educational neglect, reports of educational neglect, but only in high poverty areas and in areas that have a lot of previous experience with child welfare system. So, this is suggestive of, if you're not logging into school, virtual school, you're getting written up for educational neglect. So this I think would be right up her alley.
Yeah, so I think, she's looking, she's pulling together just, again, other jaw-dropping data with respect to, the people essentially just, like, she just had the numbers of the kids that had never logged back in when they went home in March, right? That, never
Yep.
came back even to finish the school year. And so that was the data she was looking at in the spring, much less the data that she's looking at this fall.
Yeah, it might some of the things that you showed, it might be interesting to track. You're probably already thinking about this, but tracking when schools reopened, because my own observation about this is that there's a big difference between what happened in March and what happened with school opening this fall. And there's definitely more emphasis, there's more training that happened around social emotional learning and a lot of the emphasis around tracking, keeping up with, kids who were logging in, as well as all the outreach that was done to get kids on, to be able to get online. So I'm certain that the disparities are still there, but it would just be interesting to see
Which are persistent. Yep.
Yeah, and whether online school has a positive impact on some of these negative consequences of staying at home.
Yeah, we're in the process right now. We just got the data on the school openings, sort of which schools are open, which in person, which are virtual, which are hybrid, and sort of when they're going back and forth. And somebody from the Department of Education equivalent just gave us that data. So we're in the process of cleaning it right now. And this has been a great partnership with DFACS, the Division of Family and Children Services, because they don't normally have these data available at the weekly level, and they definitely don't normally give them to researchers at the weekly level. So sort of as I was saying earlier in the presentation, this has been a real opportunity for researchers because agencies and companies are being a little bit more forthcoming with their data because they're understanding of the enormous challenges that everyone is facing right now. So it's been a great opportunity and a great relationship building experience as well, because now they're really interested in this next study focusing on school openings and that sort of thing. So yes, you're absolutely right. We think it's an important and interesting question, and we are on it.
Awesome. Well, thank you so much. This is great.
Fantastic. Thank you.
Well, thanks everyone for tuning in. Feel free to send me any questions if you have. Charity notes here that Jason and Charity are both happy to help with mobility discussions, mobility data discussions. And she's noting here that they have the most experience with SafeGraph, Cubic, and Google. And I have the most experience with SafeGraph, and then also, domestic violence and child abuse and neglect as well. And I'm happy to share the slides. Feel free to contact me if you're interested. Or Faith.
Yes, please. Yes.
Well, thanks so much.
Thank you, ma'am. Applause. Yay.
Thank you.
Thanks. Faith, did you promote next week's topic already?
I did